whether you're in New York City or Miami, Florida, or Puerto Rico, or wherever you might be, why, get in touch with us and share information and fill out the little form that we might email you, and send us your email address. If we don't have your email address, send it to us. Jim@electrotherapy.com, info@electrotherapy.com, or Donovan@electrotherapy.com, and we'll see to it that I think we should have something going on every month. And I think you should have in your office or in your city a way where the doctors, your chronic patients, can come and get information and learn what auriculotherapy has to offer. Many of those stubborn chronic patients that are difficult sometimes to handle, and auriculotherapy in sometimes just 1 or 2 or 3 points. And the fewer points you treat, like I said, if you're treating 10 to 15 points, it's usually 2 or 3 of them that do 80-90% of your work. Stay with those points. If the patient can sense when something's flowing, where they feel the pain leaving, where they feel that point is benefiting their complaint. So from headaches to back pain to sciatica to fibromyalgia, neuropathies, can you imagine a 30-year neuropathy, 2 treatments whether they need the second one or not? Pain was gone after 30 years of suffering, could hardly walk across the street, and his name is Mike Fawcett. And 6, 8, 10 years later, still no pain. Can you imagine corporal tunnel syndrome, numbness and pain for 10 years, 1.1 minute in the wrist area in the second phase, numbness and pain left, and I saw her again about 3 years later in Atlanta. The pain was still gone, and I talked with her doctor, probably talked to him 15 or 20, which she's married to, and the pain is still gone. She hadn't had the second point yet. So she's still working as a dental hygienist. One would assume that that would be right back within the next, certainly maybe 2 or 3 treatments to even help it, since it didn't come overnight. So your carpal tunnel syndrome problems are chronic, because they don't even know they have something coming on for many times a year or maybe 2 years or many months. It starts developing. And one would assume that it's going to take 3 or 4 treatments or 4 or 5 visits to take care of it. And if he's still working as a dental hygienist, he's going to be back after 6 months. But it wasn't back after 6 months. So what are we doing? So we're electrical bodies. We're releasing the body's own natural neurohormones, brain chemicals, the endorphin levels, and enkephalin, dynorphin, the body's own natural way of healing. No modality around. The trigger point therapy and all of the modalities that we can use can't hold a candle to what we can do with auriculotherapy. Dr. A.E. Sola, that did the work with Janet Travell on trigger point work. I met him in 1973 in St. Francis. I said, "What are you doing here? This is an acupuncture meeting." I know. I've been doing what you're doing since 1969. I said, "Well, you're 2 years ahead of me." I presented some of your work, your trigger point therapy in Germany in 1973. I was already more excited what auriculotherapy could do for that patient than what we were doing with trigger point therapy. Not that it wasn't good, it worked every bit as it used to work, but it's you just treat many times symptoms, and you'd have to treat several treatments to notice very much of anything. And with auriculotherapy, sometimes 1 or 2 treatments. That's why some doctors say, "I can't afford it, it works too well." Then must learn enough about it to slip off of the right points once in a while if you need to have that 2nd or 3rd visit. But many of your conditions, you won't notice a change at all in the first visit. But you treat the right points, the patient notices a change 3 and 4 hours later into the evening. So many times the doctor thinks they've totally failed, or the patient thinks the doctor has totally succeeded. So sometimes, unless the patient reports back to you, you don't know that. So many times it takes treatment plus time. You're not going to get them all in the first treatment, and you're going to have blockages, laterality situations, or toxicity with amalgam maybe, and some it's very controversial, as you all know. But also blockages such as scar tissue, where you have a toxic scar that might be blocking your treatment. Many times you've treated the patient and had not had success. Go to that scar on the body, or I've gone to it, and also we have scar where you can go to it in the ear and treat the scar. Oh, now my pain is leaving, my pain's gone. So you've already treated the condition, now you treat the scar and it leaves, and you don't even need, many times, even the second treatment. So that's why we inject the scars, and we put the electrodes right adjacent to the scar, moving them in. That's where we use the monopolar electrodes. And tinnitus is where you also use the monopolar electrodes, going into the auditory meatus with saline and going through all frequency ranges, pulling the current right through the inner ear. And you have enough voltage, it goes on up to 100 plus volts, that no matter whether you're on the scar on the body or in the auditory meatus for tinnitus, or whatever point you're treating, it's going to flow on that point, and you're balancing that point right at the point. You're not contaminating your therapy by pulling the electrode, by pulling the current from the point down to an anode that the patient holds. That is only in the circuit, in the detect mode, in the detect is how it is. So a clean, dry ear with your probe very perpendicular on the skin surface, and a very slow movement with it clean and dry, and the skin very tight. So you're going to use back pressure. Like this is a TM joint right in here. You're going to use back pressure and move that probe. That's about 10 times too fast. This is just, if you hardly see it moving, that's about the right movement. So, and when the needle moves down, if you know you haven't moved it and it comes up, well, you can still go ahead and treat the point. You have a good day, and let us hear from you. Electrotherapy.com in Tulsa, Oklahoma. Our telephone number is 918-663-0297. Our fax number is 918-663-0298. My email is jim@electrotherapy.com or info@electrotherapy.com. And let us hear from you, and we'll keep in touch. And send that form in relative to your suggestions with our workshops nationwide, wherever you might be, and we'll help support you.